Hey, this is Core Studios episode 4. I'm Insa Kim.
Yeonjang.
And I'm Yoon Choi.
So this coronavirus incident has started a long time ago, and even being on quarantine and social distancing, I bet everyone's feeling stressed, staying at home for long hours. So how do you guys all feel?
I'm just always being careful. I have a friend in Seoul and she says she can't wait to have a new school term in an online class.
And I'm just really trying to be patient as much as I can.
Yeah, I certainly agree with both of you. And now I'm missing school so much.
Yeah, I know that a lot of students are also stressed with their academic performances. And yes, I am too, but it also seems like we miss social interaction so much.
Yeah, totally.
Yes, okay, now let's get back into the context.
Sure.
We were going to talk about Italy today, correct?
Yes, you are. So last time we only outlined the briefs about Italy's situation, and this time we will look at the details of its explosive outbreak.
Let's go ahead then.
So I've done some research about Italy, and as you all know, and we've also talked about this in the previous episode, Italy is among the worst hit countries of the virus.
Yes.
And it seems like a paradox to see a lot of high-income countries struggling to even perform a proper response.
I have a question here at the moment. So you have mentioned that Italy is a high-income country and HIC. So how much better off is Italy compared to other countries?
Good question. Okay, so to have a better look, I'll compare Italy with India, a low-middle income country. Okay, let's look at general statistics first. Italy's GNI per capita is 40,030 purchasing power parity, or PPP dollars. And for India, it is 7,060 PPP dollars. Even from this, we can make a clear distinction. The global HCI rank, which is a measure of development, is 130 for India and 28 for Italy. And we can also look at the population pyramid. Imagine the y-axis showing the different age groups, increasing as it goes up, and the x-axis showing the percentage of the age groups. These bars for each age group come together in this diagram and forms a shape. So India's diagram seems to be near vertical till age group 30 to 34, but it narrows down as it goes to the top. This actually is a good state, viewing as a long-term perspective. So most of the population takes up the working population, and because birth rates are declining, India will have a narrower base in the diagram as the year passes. So then the country would then keep a low dependency ratios and may allow themselves to have the demographic dividend, a period of fast economic growth due to the bulge in the number of adults.
But focusing on the coronavirus, I think that wouldn't have an impact on mitigating the situation, doesn't it? They're ready to have an economic growth, but they haven't gone through it yet.
So looking at the short term, you're right. This diagram shows that the country may not be incapable of dealing with the pandemic. But for Italy, the period for demographic dividend has far passed. So the working population during that period has aged. This makes Italy's elderly dependency ratio of 36.6 much higher than the India's, which is 9.8. So looking at the diagram, we can clearly see the difference. The shape of the bars is more like a vertically stretched pentagon with the highest population percentage around the age group 45 to 54. And for India, this age range is 10 to 19, which is quite young.
Yeah.
And the diagram also shows that there are 3.8% of Italy's population between the ages of 80 to 84. And for India, there's only 0.6%. So this diagram is a proof that Italy is highly developed. But let's just remind ourselves about the most vulnerable people in this coronavirus pandemic, the elderlies. Maybe this can mean something for Italy's situation.
now we're clear about the differences between the two countries, but these two countries are both severely affected by the coronavirus, and I don't understand. How could such a well-off country like Italy could struggle with the disease?
So I'll say that testing is a key factor to control the virus, and Italy wasn't able to perform them well. But before answering this question, I would like to first address the issue of death rates. So passing through social media and the internet, we often see bar graphs comparing the death rates of the countries. But I want to say that death rates itself are not a direct indicator to identify the severity of the situation.
Why not? Doesn't it show how much people are dying in the country?
Well, not quite. So the death rate is a ratio of the people dying from the virus versus the people who are confirmed to have the virus. And also, there are two kinds of fatality rates. Case fatality rate is the proportion of people who die after tested positive for the virus. The infection fatality rate shows the proportion of who dies after having the infection overall, including the people who are not tested. So, for example, imagine that there are 100 people infected of the virus, and among them, 10 showed serious symptoms and went to the hospital. The other 90 people are not tested at all. Then one of the 10 hospital patients dies. In this situation, case fatality rate would be 10%, but the infection fatality rate would only be 1%. And previously, I answered your question that testing is the key factor to contain the virus. It is because exactly knowing the situation gives us an idea of how we should manage the pandemic within the country.
I see. And I just wanted to add an idea here. South Korea now is viewed as a model of well containing the virus, and we are having much more tests than other countries. I think that testing for the virus could also contribute to having an accurate picture of how the virus is affecting the whole population, including the asymptomatic people. So, borrowing your example of 100 coronavirus patients, the 90 asymptomatic So, borrowing your example of 100 coronavirus patients, the 90 asymptomatic people who did not take the test would freely go around public areas, causing the virus to spread. And we could stop this from happening by testing as many people as possible.
You're absolutely right. Like I said, testing is the key factor here. Okay, and now answer why Italy wasn't able to test its people well. Before I mentioned how Italy has a high elderly dependency ratio. In fact, they are the second highest on earth. And this highly vulnerable age range of 65 or over takes up 23% of the entire Italy's population.
Wow.
And at the same time, young Italians tend to interact with the elderly more than others. These people may live within rural areas with their families, but commute to work in cities like Milan. These people socializing in urban areas and interacting with large crowds may have been a carrier for the coronavirus to the elderly in the rural areas.
Definitely.
Right. And another problem is that this silent spread of disease over rural and urban areas is assumed to have been going on way before their detection of the first case of the virus. It means that the scale of the spread is already too broad to get an accurate view of the impacts. In this time, April 5th, there are currently about 125,000 people confirmed to have the virus. However, we expect much more. And making the matter worse, the country's healthcare system seems not to be prepared for the pandemic. Investments in public healthcare make up only 6.8% of the country's GDP, which is lower than those of other countries in the EU. And lastly, let's look at their testing results. So, testing rates. This data chart, based on the information of March 10th, shows a global rank of the countries testing the most people per million people.
So here, South Korea is at the front line, having more than 4,000 tested per million. Then there are about 150 cases per million.
South Korea has been a global model to well contain the virus for the past few months.
Italy is in second place, and they tested about 950 people per million.
But we should acknowledge that Italy was already having a hard time with the virus.
Yes.
So considering the situation, this is far behind than the other countries. See that there are nearly 150 cases per million. The rate exceeds the one of South Korea. The combination of worsening stage led the country to have the worst outbreak. However, this desperate situation is projected to be continued. I certainly believe that Italy is going through these tough times could be an opportunity to get valuable lessons.
We figured that the country is far enough wealthier than such LICs, but then they still had problems like the poor healthcare systems.
Also, they had a huge burden on the large elderly population. Maybe Italy will put more care on these problems after the pandemic is relaxed.
I hope so. This is our fourth episode about the coronavirus.
Thank you everyone for listening. I hope you stay safe for the rest of the period.
Blue Record will be back soon
With another interesting
And worthy topic.